beautiful people. Welcome to another video from Chisom G. If you haven't already, make sure you like, comment, share, and subscribe. Guess who's finally a second-year fellow in her last year of training? Moi! Wow, it's been a long time coming. Today is July 16th and I am about 2 weeks into second year, and I can't be more excited and more grateful for this journey. Honestly, it hasn't been easy. Almost, I would say this has been a 10 plus year journey, and I'm happy to finally be at the end of it. Sometimes I look at a few of the attendings that I work with and I'm so excited to eventually be in their shoes, where I'm no longer having to speak to attendings before I do what I want to do for my patients. Yeah, which is nice. Obviously, you're in training, you're still doing work under the attending's license, but sometimes I think it would be nice to just see a patient, decide what I want to do, and then keep moving on to the next patient. I've definitely grown, I would say. I can actually see the growth and feel the growth. Especially when I'm working with first year fellows, even within the past 2 weeks, I can see that I've grown because I'm teaching them things, for example. I've learned a lot about rheumatology. I've learned how to clinically think when it comes to patient management much better. I have more time to study. We have actually dedicated time to learn. So I think I've learned a lot throughout this last year. I've done so many case management projects, started research projects, connected with people from other specialties like nephrology, IED, because we work so much with them in rheumatology. But I've learned how to communicate with teams, how to communicate with other specialists. It's been a journey, and I'm happy to be at the place that I am right now, to be honest. And for those who are still applying for med school, who are still applying for residency, who just started residency a few months ago or weeks ago, I just wanted to let you know that it does not get better. I'm joking. I'm semi-joking. So I feel like in medicine, they keep telling us it's going to get better, but then every year it gets worse. But I will say that after residency, it does get better. Depending on the fellowship you choose, if you do fellowship. And then after fellowship, I think it gets better, but I'll tell you about that when I actually become an attending. I don't want to make this video too long, so I will say maybe a few tips to consider as you're starting residency and fellowship. Number one, make sure you ask for help. Be nice to your nurses. Be a team player. The people around you are going to be the ones who are truly going to help you. Secondly, bask in the idea and the belief that you don't know everything, and look it up. Don't be embarrassed to look it up in front of the patient. The patient asks you a question, don't make up something. Just be like, let's look it up together. Or if you really don't want to do it in front of the patient, then you can just leave the room and look up things. Believe that you don't know everything, because you don't. That's 2. And then number 3 is find a stress reliever. And when I say stress reliever, I don't mean crazy things like, let's say, what are some crazy things that people do to cope with stress? Alcohol. No, don't do that. Look for something, a good coping mechanism. This can be talking with a friend or a family member at the end of the day. This might be treating yourself to sweet treat at the end of the week. This might be doing a hobby, finding a new hobby, reading at the end of the night, having candles at the end of the night to increase the nice aroma of your workplace or home. Find a stress reliever now. And if you need to, get a therapist. I don't have one, but I heard it works. And I actually did try to get one sometime in residency. It just took a while to find one, so I gave up. But if you have the time now, I would say that you look for a therapist if you need it, because you'll need someone to chat with. If you can pray, that's a form of therapy. But if you want a person, you can get a therapist. But those are just a few tips that I have for you now. And it gets better. Do your best. You're enough. And make sure that you do the best that you can for your patient. All right, toodles, and you got this. You got this. You got this. You didn't come this far to fail. All right, toodles, bye.